12 signs of cancer women ignore that could save lives. Hi, guardians of health. Ready to transform your health today? Did you know that some signals from your body could be important warnings but are often overlooked? Especially among women, small symptoms can be ignored but may reveal serious conditions like cancer. Unfortunately, this happens frequently, and ignoring these signs can delay a critical diagnosis. Today, we're going to reveal the 12 most ignored signs of cancer among women. From seemingly simple changes, like persistent fatigue, to more subtle ones, such as unexpected bleeding, we'll explore how these indicators can be noticed and why it's so important to pay attention to them. Recent studies show that early diagnosis drastically increases the chances of successful cancer treatment, but it depends on recognizing the signs in time. Are you ready to learn about the symptoms that could save your life? In this video, you'll learn clearly and practically which signs to watch for and how to act if you notice anything unusual. Small actions can make a big difference in your health. So, get ready to be surprised and, above all, to take better care of yourself. Unexplained weight loss. Have you noticed a significant drop in weight without changing your diet or exercise routine? While many people see this as a positive, unexplained weight loss can be a warning sign for various types of cancer, including those affecting the digestive system, such as stomach, pancreas, and esophagus cancers. When the body starts consuming energy abnormally, it may indicate metabolic changes caused by cancerous cells. Studies by the American Cancer Society show that losing more than 5% of your body weight in a few months without a clear cause requires immediate medical attention. If you notice this symptom, schedule a doctor's appointment. Additionally, keep a food and weight diary to track changes over time. Never ignore these alterations. Excessive and persistent fatigue. Feeling tired occasionally is normal, but when fatigue persists for days or weeks, even after adequate rest, it could be a sign of cancer. Extreme fatigue is often associated with cancers like leukemia and colon cancer, where the body uses more energy to fight the disease. The underlying cause is the excessive production of inflammatory cytokines or chronic blood loss, which can occur internally and silently. According to the National Cancer Institute, persistent fatigue is one of the first signs reported by cancer patients. To address this symptom, monitor if it's accompanied by other signs, such as pain or weight loss. It's crucial to seek medical guidance if fatigue significantly impacts your daily routine. Changes in the skin. Have you noticed spots, wounds that don't heal, or changes in skin color and texture? These changes may be signs of skin cancer, such as melanoma, or other types affecting internal organs. The skin acts as a mirror of the body, and signs like persistent redness, scaling, or irregular moles should be taken seriously. According to the Skin Cancer Foundation, one of the most concerning signs is the appearance of lesions with asymmetrical borders or rapid changes in existing moles. These changes could indicate the presence of abnormal cells that need to be investigated promptly. Use sunscreen daily and perform regular self-examinations, checking your entire body, including less visible areas like the soles of your feet. Identifying changes early can make all the difference. Unusual bleeding. Bleeding outside of your menstrual cycle or after menopause are signs many women ignore but could be related to gynecological cancers, such as cervical or endometrial cancer. Blood in the stool or urine are also symptoms that warrant specific tests to rule out cancers in the intestines or bladder. Blood is one of the clearest signs that something is not normal in the body. According to the American College of Obstetrics and Gynecology, any unexpected bleeding, especially after menopause, should be evaluated urgently. Do not ignore these signs and consult your doctor for tests such as transvaginal ultrasounds or colonoscopies, if necessary. Remember, the earlier the cause is discovered, the better the chances of effective treatment. Lumps and swellings. Finding a lump or swelling, especially in areas like the breasts, armpits, or neck, can be alarming, but it's also one of the most critical signs to seek medical help. Painful or painless lumps that persist for weeks could be linked to cancers such as breast cancer, lymphoma, or thyroid cancer. According to the Breast Cancer Research Foundation, lumps that grow in size or feel firm require immediate attention. Regular self-examinations can help detect early changes, but remember that only medical tests can confirm whether there's cause for concern. If you're looking for a practical and comprehensive resource to improve your health and learn how to maintain balance in your body, check out the pinned link in the comments. It offers incredible tools to help you feel more confident and healthy. Breast changes in the texture, color, or shape of your breasts are also signs women should not ignore. Wrinkled skin, redness, or an orange peel-like appearance, as well as unexpected discharge, could indicate inflammatory breast cancer, a rarer but aggressive form of the disease. Doctors from the American Society of Clinical Oncology emphasize that visible breast changes are often noticed before physical symptoms, like pain. In addition to self-exams, it's essential to have regular mammograms based on your age and family history. To make detection easier, keep a record of any changes you observe and inform your gynecologist of any abnormalities immediately. Digestive system changes. Persistent changes in your digestive system, such as constipation, diarrhea, or blood in your stool, could indicate colorectal cancer. Although this type of cancer is more common in people over 50, it can also affect younger women, especially those with a family history of the disease. These symptoms are often related to changes in bowel function. According to the National Cancer Institute, any changes lasting more than a few weeks should be investigated with tests like colonoscopy. To maintain intestinal health, include fiber in your diet, stay hydrated, and watch for additional signs such as unexplained weight loss or abdominal pain. Abdominal and pelvic pain. Frequent pain in the abdominal or pelvic area, often dismissed as minor, could signal gynecological cancers like ovarian cancer. This type of pain is common, but when combined with bloating or a feeling of fullness after small meals, it may indicate something more serious. The Ovarian Cancer Research Alliance notes that women often notice these symptoms but attribute them to less severe conditions like gas or menstrual cramps, delaying diagnosis. Keep a symptom diary to track patterns and schedule tests such as ultrasounds or tumor markers if the symptoms persist. Urinary changes. Changes in urination patterns, such as blood in the urine, pain when urinating, or increased frequency, may be linked to bladder or kidney cancer. Women often confuse these symptoms with urinary tract infections, delaying an accurate diagnosis. These signs occur because tumors may interfere with normal urinary function, causing inflammation or blockages. The American Urological Association recommends that persistent symptoms, especially blood in the urine, be evaluated immediately. If you're looking for more information to care for your health practically and effectively, check out the pinned link in the comments. It can be an important ally in your journey to wellness and prevention. Difficulty swallowing. Frequent difficulty swallowing could be a sign of throat or esophageal cancer, especially if accompanied by weight loss or the sensation of something being stuck in your throat. This symptom might indicate that a tumor is interfering with the upper digestive tract's function. Researchers at Johns Hopkins Medicine report that while this is often associated with conditions like acid reflux, persistent symptoms should be evaluated with tests such as endoscopy to rule out more serious possibilities. To temporarily relieve discomfort, avoid acidic foods and chew thoroughly before swallowing, but seek a specialist for a detailed diagnosis. Persistent cough. A cough that doesn't go away, especially if it's dry or accompanied by blood, could be a symptom of lung cancer. Although many people associate lung cancer solely with smoking, it can also occur in non-smokers. According to the American Lung Association, a persistent cough is one of the first signs reported by patients, especially in the early stages. This occurs because tumors may irritate the airways, causing inflammation or obstruction. If a cough lasts more than 3 weeks, consult a doctor. Tests like X-rays or CT scans may be necessary to assess lung health. Menstrual or postmenopausal changes. Abnormal bleeding during your menstrual cycle or after menopause are important signs that could be linked to cervical or endometrial cancer. Even light spotting can be a warning to seek medical help. The Brazilian Society of Gynecology emphasizes that postmenopausal bleeding should be treated as an emergency until proven otherwise. This may involve imaging tests like ultrasounds or endometrial biopsy for a more precise diagnosis. To prevent serious issues, maintain regular checkups with your gynecologist and always pay attention to changes in your cycle. Caring for your health. A vital commitment. Taking care of your health is, above all, about listening to the signals your body sends. The 12 most ignored cancer signs among women discussed today may seem harmless, but paying attention to them can literally save lives. From weight changes and persistent fatigue to skin changes and unusual bleeding, every detail matters. Remember, early diagnosis is the key to more effective treatments and faster recovery. So, don't hesitate to seek medical guidance if you notice any of these symptoms. Taking care of yourself is the greatest act of love you can offer yourself and those you love. Now we want to know, which of these signs did you find most surprising or have you experienced before? Share your thoughts and experiences in the comments. And of course, don't forget to like this content, subscribe to the channel, and share the video with other women you want to see healthy and protected. Until next time, guardians of health. Stay strong, stay healthy, and keep thriving.